Let's shine by seeing the best in all of us and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Hi, I'm Sherry Harlan Davis, program host for Let's Talk Together. And today we are discussing Minority Mental Health Awareness Month. And my first guest is Dr. Dele Oladapo. Make sure I have that right.
That is
and
correct.
Welcome.
Thank you, Ms. Ali. Nice to meet you.
Nice to meet you.
Thank you. Thank you for having me.
Before we get started, tell us how you came to Reid.
I came to Reid in 2017, so it's almost 6 years now. So I did my training in psychiatry in Cleveland, Ohio. So because of the geographical location, so I ended up in Richmond, Indiana. And since then, I've been loving it, taking care of our community. And now I'm here today.
So you moved south, a little south.
Yeah, a little south, yes. And there's a reason for that, you know.
Okay.
My parents, they live in Atlanta area, so it's kind of a little bit more proximity, so in terms of, geographical location. So.
Well, great.
Yeah.
We want to highlight Minority Mental Health Awareness Month. And actually, what is the observance, some of the origins of minority mental health?
So in terms of Minority Mental Health Month, in May 2008, the United States House of Representatives, they actually named the month of July as Minority Mental Health Awareness in honor of the Black mental health advocate named B.B. More Campbell. So that's how we get to where we are today. So next month, which is July, it will be the Minority Mental Health, which I'm very passionate and excited to talk about today.
And looking at the purpose to improve access to mental health treatment and services, and promoting more public awareness of mental illness within our BIPOC communities.
Right. So in terms of promoting mental health awareness, there's a lot of resources out there. So I can give you a little bit of statistics when it comes to different minority groups. So when we're talking about, I think nationally, the percentage of mental health nationally, I think it's about 20%. And this data came from Mental Health of America, which is one of the non-profit organizations. So when you break down different minority groups, you have Blacks, Native Americans, Hispanics, and Latinx, and multiracial. So in terms of the Black mental health, so that was about 17%, so which is pretty significant. And then when you look at the Native American, the number is even higher. So it's about, I would say, about 23%. And then when you look at the Asian American, so it's a little bit lower, 13%. And then when you go to multiracial, it's about 25%. And also, when you look at LGBT community, that's the number is even more astronomical, so 25%. So it's a whopping statistic. So in terms of accessing the resources for this and some of the issues, so I think one of the challenges is access to mental health. So, and then one of the things we are doing right now is there's a lot of organizations out there. One of them is NAMI, which is National Association of Mental Alliance, so NAMI. So it's a big umbrella. They have different branches all over 50 states in the United States. So we also have the local chapters here in Indiana. It's based in Indianapolis. So people can access their resources go to their website. They have a lot of resources for people to access mental health care and support. Also, we have other organizations like Mental Health of America. So they have a website also. There's a lot of resources there. People can utilize screening tools. So also we have the suicide crisis lifeline, which is a new number that was created by Samsung in July 2022. It's 988 number, so people can call anytime they're in crisis. So the other resources out there, people can reach to their local provider, actually, like your primary care physician. That's always the best way to start. And then we have some local community mental health also, especially here in Richmond. We have Centerstone, we have Meridian. We also have, of course, we have Reid Health. So
Right.
you can call our outpatient office, and our number is 765-983-3298. Or you could call the hospital directly. The hospital has a main line, which is 765-983-3000. So there's a lot of those resources.
And one of the things when you mentioned NAMI, I know that for a while in Wayne County, we didn't have a chapter, so it was a big deal when NAMI came back into the Wayne County area.
Yeah, NAMI has been a tremendous asset. I mean, they actually do annual events to promote public awareness related to mental health. So it is a great resource that people can utilize and access resources. So.
And on the area of disparities among minorities in mental health, we gave some of those numbers. What are some of the obstacles that you see?
That's a very good question. Thank you for asking. I think one of the challenges that we have, so I think insurance, lack of insurance is always one of the challenges. Some people are underinsured, and when we're talking about challenge, we have to talk about stigma, mental health stigma. That's pretty significant. A lot of people still don't want to talk about mental health and come out, So the good thing, we have a lot of resources out there now, so there's no reason to be ashamed. Even there's a lot of celebrity right now. They start talking about it. I can name a couple of celebrities. For instance, Senator John Fetterman in Pennsylvania recently was just hospitalized for depression, post-stroke depression. So mental health, it has no boundary, actually. It can affect celebrity, politician, regular people. Another challenge is the language barrier. A lot of people from foreign country, they have like language barrier. For instance, maybe they don't speak English. So we do have language interpreter also. So that shouldn't be a barrier to access to mental health services. Other challenges that I wanted to refer to is we have diversity in mental health provider. So that's always, sometimes people always feel very comfortable. People of their own race sometimes. Sometimes people don't want to open up when they see provider from different ethnicity or race. So that's another area. And also some people have distrust in mental health. People sometimes they just don't trust because of confidentiality or even HIPAA. People don't think they can protect their record, And we have other challenges also, like I said, cultural competency. So that's actually very, very important. In residency training now, they are teaching provider about competency, cultural competence. So people from different countries, the way they manifest depression, anxiety is different from maybe people in the United States. So
you said they're actually teaching that in
they are teaching that in training, in residence.
Great.
So you have to be very culturally sensitive, when you are interviewed. For instance, like Hispanic population now, the way they present anxiety is different from somebody from like American, for instance. So you always need to be aware, be culturally minded person. So that's very important. So,
And one of the things that do you find that often in minority communities that also with the stigma, I know, and I've seen people like, I can't possibly be depressed. I'm a Christian or I go to church, so they don't think they need to get any kind of assistance.
I think this is where something we call psychoeducation come into play. So we need to educate the community, do mental health awareness like we are doing right now. You know? People need to understand mental health is just as important as physical health. So if you don't take care of your mental health, it's very difficult to function, you know. So you have to take your mental health serious, just like your physical health, like diabetes or high blood pressure. So the good news is mental health is treatable. It is sometimes preventable. So so we need to do more education, you know. Like May is Mental Health Awareness Month, and then July is Mental Health Awareness for minority groups. So yeah, so more education. So
that would be one of your big things to make sure, and we're thanking you for being here, because that just brings more awareness out into our community.
Absolutely.
Before we close, what would you like? One last thing, would you like the community to know?
I think I would like community to know that, you know, there's help out there, you know. I mean, I want people to reach out if you're in crisis. So there's help out there, you know. You could go to NAMI website, like I said, it's NAMI.org. And also they have a Mental Health America. That's another website that you can utilize. It's called MHA.national.org, you know. So also you could do Google search, you know. We have like local mental health resources here. Center Store is one of them. Meridian, we have Reid, you know. You can call your family doctor, because most of our population, they usually start with their family doctor because they feel very comfortable, you know, because of stigma that I said earlier, you know. People sometimes they prefer to go to their primary care physician than even psychiatrists in the beginning. So, but just know there's a help out there for you, you know, to access. So.
Okay. Well, I want to thank you, Dr. Oladapo,
yes,
for joining us today and educating our audience about minority mental health awareness.
All right.
Thank you for joining us.
Thank you for having me.
Let's shine by seeing the best in all of us and by looking out for everyone's well-being. Let's shine by staying true to ourselves while surging toward the future. Let's shine with the best care possible and by treating you here, right in your hometown. Let's look out for each other. Let's stay healthy. Let's shine together.
Welcome back to Let's Talk Together. And joining us now is Sunnie Allen. And Sunnie is with Sunlight Wellness. Sunnie, tell us a little bit about yourself.
Sure. So I'm a Richmond native. I am licensed as a mental health counselor as well as a licensed clinical addictions counselor and board certified telemental health provider. So I started my virtual private practice in 2021. So I've been doing it a little over a year. But most of my clinical experience comes from community mental health settings. So I've worked at Meridian, Centerstone, and I've worked with a wide range of populations, anywhere from residential inpatient substance use, outpatient substance use. I've worked exclusively with people who have a mental health diagnosis alone. And then, see, what else have I done? I feel like I've done so much. I've also done school-based work, so I've done a little bit of everything, but most of my experience is with people that have co-occurring disorders. So usually people that have a substance use disorder and a mental health diagnosis as well.
And what drew you to this profession?
Everyone asks this question, and it's usually a cliche answer. I just really feel like this is what I was called to do. I remember being in high school and telling people that I wanted to study psychology because I was always very interested in learning about why people do the things that they do. And I was also very fascinated by the fact that two people can have a very similar experience, but have two totally different reactions. And so that kind of interested me and drew me into psychology. And then from there, I went into counseling.
So what are some of the issues that you're seeing in our community?
Issues that I'm seeing in our community, one of the issues that I see really is lack of representation of colored providers. There's not a whole lot of diversity. And I think sometimes, in terms of minority mental health, I think that kind of holds people back from getting help. I can't tell you how many times people have walked in my office and said, I sought you out because you look like me, or I sought you out because you're a woman of color or a person of color, and you can somewhat relate to the experiences that I have. So I would say lack of representation, obviously stigma. I think stigma kind of fuels that shame and kind of keeps people stuck, keeps people from reaching out and getting help. But another thing that I'm seeing as well, I don't think that there is enough training and education on culture and how that impacts a person's mental health, how that impacts how people are showing up in those spaces. I think that there's a difference between being a culturally competent provider and cultural humility. And what I mean by that is we can take courses and take classes about culture all day, but if we're not practicing cultural humility and really opening up space for people to share, right? For kind of the therapist to take the back seat and let the client share about their culture and work kind of hand in hand, you can see how that's two totally different things. So I think that more training and more just awareness of how culture impacts people in mental health spaces.
The therapy is considered taboo in certain racial, ethnic communities. What things can be done to curb that stigma?
It definitely is taboo in many communities, especially communities of color. I think the better question to ask would be, what happens if we don't talk about it, right? What happens if we don't have those conversations?
And what has happened when we don't talk about it? Because you see those people.
Absolutely. So when we don't talk about it, we stigma doesn't go away, right? Shame, right? Suffering, all of those things continue when we continue to not have conversations about it. And so I think that the more we talk about it, the more that we as providers as well are aware of our own culture and how we're showing up to those spaces. If we're not aware of those things, then we can sometimes do more harm to our clients than good. And so I think that providers need to be aware, but consumers also need to be aware, and communities need to be aware of the things that will continue if we kind of continue to suffer in silence.
And do you see cultural backgrounds influencing communications and treatment?
Communications and treatment, I do. I see that. Again, if a client is coming to you and they are seeking mental health services, and some of their mental health challenges are related to culture, right, are related to racism, to discrimination, to inequality, right? And the counselor is not aware of how that person's culture could impact that, right? Again, we're doing more harm than we are good.
And I just thought of something.
Yeah.
I know that you've had like group sessions with, I found that really interesting that I've followed you on social media, and how you had like a group sessions for younger women of color. How's that working?
So I actually have not had many people reach out to me interested.
Wow.
Surprisingly. So I try to kind of put things out there for specific populations, for women of color, for young women, because I see the challenges. But there are not a lot of people that are reaching out and taking advantage of those services.
Wow.
So yeah. So maybe it's a marketing thing on my end. Maybe it's just exposure. I'm very introverted, so I don't really put myself out there like I probably should. But yeah, there's not been a whole lot of feedback.
On a separate note, from another community program we discussed, and we had young men, and we're discussing mental health.
Yes.
And one of the gentlemen did a Facebook post about mental health.
Oh, cool.
However, it really went completely different than the lane they thought they were going.
Yes.
So,
and that's a challenge that I'm running into is, having all these resources and these ideas of things that I want to do, but not the people to do it. So hopefully we'll find ways to overcome that challenge.
do you use a different approach in your treatment when you're working with patients from different cultural backgrounds?
Yes. So one size does not fit all, right? And so the first thing that I like to do is really learn about my clients. And that kind of goes back to what I was saying about cultural humility, right? I kind of take the back seat and allow the client to tell me, to teach me about who you are, what are your beliefs, right? What's your background? What's your religion, right? What religious affiliations do you identify with? All of those things matter. And so I would say that's probably one of the first things that I do with people, and then I kind of go from there. So one size does not fit all, right? So you have to learn about each client individually and then kind of base your treatment and how you approach that client based upon that.
And back on when you were saying with the group and with the younger women, and that you didn't have the response that you thought, and then that brings up stigma.
Yeah, absolutely, absolutely.
So do you run into that a lot with people saying, I want to come to you, no, I better not, because people misinterpret or they're concerned what other people will think?
Absolutely, yes, I do see that stigma, definitely. I think that another barrier for my practice has been I don't accept Medicaid. So I only do private insurance.
Okay.
And a lot of people struggle to be able to pay cash for services as well. So that is a barrier that I've ran into. And then with, you had asked the question about, some challenges that I'm seeing in the community. For a lot of people that do have Medicaid, they're getting their services primarily from community mental health settings. And there's nothing wrong with that. You get great care from community mental health settings, but the problem is that a lot of clinicians working in those settings are very overwhelmed with large caseloads, which leads to burnout, right? Compassion fatigue, and so people end up not getting the care that they need just because therapists are so busy and overwhelmed. So there are barriers there with.
And I know another barrier is with the turnover and the lack of people coming into
That's right.
the profession.
That's right, absolutely.
So there's the need, but
Yes.
just to get people there
Absolutely.
is a challenge.
There's a lot of hoops that a person has to jump through to become a licensed therapist. We have our graduate program, and then post-grad, we have a lot of hours that we have to accumulate before we can become licensed. So it's a challenge to get there.
And back on the cultural humility, and you're providing a space, or how would you say can you do some partnerships? Are there other things that we possibly can do to make people more aware of what you're doing?
That's a good question, Sherry. Making other people aware of what I'm doing.
And that's why you're here.
Yeah, I was gonna say exposure, right? Putting myself out there. Like I said, I'm new to this private practice thing. And I do everything by myself. I don't have anyone helping me with marketing. I don't have anyone doing any of that stuff. So everything I do is on my own. And so I'm really just trying to figure it out, right? How to market, how to run a business, right? How to be a good clinician all at the same time. So I think just exposure probably, better marketing, and just doing more things like this, having conversations.
And what would you say, how do we learn and how can we help and help each other if we don't ask? So what would an idea you would have for that, to help each other be more accessible to mental health awareness?
Help each other as far as like within communities? Is that what you mean?
Yes. Some suggestions, possibly.
Yeah, that's a good question. I think it goes back to not being afraid of having that conversation. Connecting people to resources. There are plenty of resources out there. Connecting people to resources. And there was one other thing that I was going to add. I lost my train of thought.
And then I'm just off the top of my head, or just possibly I could think of maybe church groups.
Yeah.
Because I know in the African American community it's such a big stigma that I go to church so I don't need counseling.
Right.
But you do.
Yes, absolutely.
So
when you break a leg, you go to the doctor.
Right.
Right. And so the same is true for mental health. If something is not right, if you're depressed and your ability to function is impaired, right, you need treatment. Right. And everything that we do as mental health counselors is based upon research. So it's not just like you're coming in and I'm giving you advice. Right. Everything that I'm doing with a person is based upon evidence-based. It's evidence-based treatment. And so it's the same for medical, right, as it is for mental health. So another thing that I was going to add as well, goodness, I lost my train of thought again.
No, we're going to come back there.
Yep.
And if we want to get in touch with you,
Yes.
Sunnie, we can go to, I know we have Sunlight Wellness.
Yes. I have
and
a Facebook page.
we have it on the screen. Information. And just because it's an 812, she's local.
Yeah. Oh, I remember what
make
I was
sure.
going to say. Can I say it?
Yes.
Another thing I was going to say when you were talking about kind of how can we break the stigma and how can we get people to access care, I was going to say that for people out there that are needing mental health treatment, that are wanting to get therapy, don't be afraid to ask questions. Don't be afraid to be picky about your therapist, right? Find a therapist who has training, is culturally competent, right? Who is familiar with working with populations that are similar to you. Don't be afraid to ask those questions. That's what I was going to say.
Well, we want to thank you for joining us
Thank
today.
you for having me. I appreciate it.
And thank our audience for joining us on Let's Talk Together.
Thank you.
Let's shine by seeing the best in all of us and by looking out for each other. Let's stay healthy. Let's shine together.